with us in studio, the president of, is it CEO?
President, CEO, however you want to say it.
President, CEO, and starting pitcher.
I like that idea.
For, WVU Medicine, Princeton Community Hospital.
Yes, it's a mouthful. You got it right.
Okay, all right, yeah. So, hi, Karen Bowling. How are you?
Good. How are you all today?
Doing well. So, you're making the rounds up here. How are things going down there in Princeton?
It's great. We love it down there. It's a great hospital with great employees, great physicians, and I'm having such a good time.
You guys have expanded.
Oh, so yes. I was thinking back. When I was driving over here to be on the show with you all, I was thinking back. I've been down at Princeton about 4 years, and I look back at all the things that WVU Medicine has been able to do for that hospital, bringing services local, close to home. And I'm really actually sort of astonished. I mean, we've built a new cath lab, a state-of-the-art cath lab. We brought in cardiac CT. We have a machine there's only one of two in the whole East Coast to do cardiac CTs if you need that. So we've really focused on our cardiac service line. We've done a really great job with our cancer services, and we're going to do a future expansion. I'll come talk about it sometime if you'd like to hear about it.
Yes, absolutely.
Our most recent announcement is one I'm super proud of, which is our affiliation with WVU Medicine's Children's Hospital, because I love children.
Yeah.
I really, I'm very connected to my grandchildren, Madeline and Mila.
Yes.
We see each other sometimes.
All the time, yeah.
My oldest granddaughter, Madeline, loves the theater, and so I know we've crossed paths.
Yep.
I know. So, this project for me was like a labor of love, being able to think about what can we do to bring more services to children in our community. Being from West Virginia, I have always felt like we were underserved in a lot of different ways.
Yeah, absolutely. I would agree with that.
I remember talking to parents who, and I guess this would change that, who would talk about the fact that they have to take their kid to Morgantown. So now they can go to Princeton.
Be able to get services.
Right.
Can they now go to?
Absolutely. So what we have, and this is
a game changer, especially if you have a child with a chronic condition.
Exactly.
Because, that's huge, Karen.
So currently we have a telemedicine clinic that has 16 specialties from Morgantown.
Okay.
We also have a pediatric cardiologist that comes twice a month for an in-person clinic to see kids in Princeton. The 16 specialties really encompass almost anything that you could think of. In terms of what a child might need. If your child needs an endocrinologist, like they have diabetes or problems like that. If your child needs a neurologist, if there is issues with, for example, pulmonary problems or lung problems, heart problems. I mean, you just go across the gamut. There's probably every different specialty that you need for your child to see can be seen in Princeton in our clinic. We have a nurse practitioner. Basically, the children come in and the nurse practitioner assesses the child. If you need any kind of testing done, you can have it done at our hospital, so you don't have to travel to Morgantown. And then, of course, after the nurse practitioner assesses and puts the information in the chart, then right on the screen pops up the specialist from Morgantown who's actually able to review all your information and then actually see your child and talk to you as a parent. And it is really a game changer. I mean, we've had our really academic medical physicians that are up there that are subspecialists have told us that, over the past year or so, they've seen kids that they were never able to get back to Morgantown, right? I mean, there were transportation issues or other problems.
Gosh, yeah.
And just being able to have that, is really, I think, something that we all should be excited about in Southern West Virginia.
Well, when you think about, because, good Lord, I could go on about this because this is something that as a parent of a child with a disability, I've talked about for a very long time, is that parent has to take time off from work. That parent has to be able to get to Morgantown. If there's testing or if it's a sleep lab or if it's something like that, they got to get a hotel. I mean, the expense is it can be monumental. And even if that child is admitted, then you've got to meet, a whole lot of qualifications, to have it just 30 minutes down the road.
Yeah, it makes a difference.
It makes a huge difference.
Yeah, I think about
in access to care.
If a child has a first thing in the morning appointment, a lot of times parents will go, well, let's go and stay the night. Let's go to a hotel and spend the night, rather than drive at 3 hours at 4 o'clock in the morning.
I had an employee. It's interesting, that you mention all that, because I had an employee that has a child with special needs that actually sees 2 different types of specialists in Morgantown. Mm-hmm. And when we got our telemedicine clinic up and running, she came to me and said exactly what you said. She said, I had to miss work. Yeah. She said, I had to drive. There was an expense involved. And she said, now I take off during my lunch break.
Yeah.
For my child to be seen.
I mean, that's when I say it's a game changer, it's a game changer.
It really is. Yeah.
An amazing game changer for a lot of families, especially in these rural communities that don't necessarily have the financial freedom to be able to just get up and go.
Right. And I'll tell you another thing we just, this again with our children's announcement last week, the other thing we just started is, and nowadays most children's services are outpatient. You don't admit a lot of kids to the hospital, but if you now have to be admitted, we have a pediatric hospitals program, but we have a consultative services set up now with Morgantown. So let's say your child, is sick and needs to be admitted. First, we went through a certification for our emergency room called Always Ready for Kids, which means that an outside entity came in and they evaluated our emergency department and determined that we had all the equipment, we met all the requirements to be always ready for kids. Mm-hmm. And there's some other hospitals across the state that have that, but it's a pretty intense thing to show that, you're there and want to take care of kids. If you're admitted to the hospital, and this just started last Wednesday, let's say your child is admitted, maybe they just have the flu or something. Maybe they just need fluids or something. But then let's say they start getting sicker and they have other chronic conditions. Then we can actually reach out to Morgantown through our telemedicine service and contact your doctor, and they can either see them on telemedicine, they can pull up their chart, they can review their record, and they can say, yeah, the child's fine, just keep doing what you're doing, you'll be able to keep him there in Princeton. Or they can say, nope, you know what, we better see the child up at our children's hospital, and then we make arrangements and we get them up there.
Yeah.
And they have that continuity of care. The chart and everything we've already done in Princeton is right there, easy access for those folks at the children's hospital.
Karen, this is like, I wasn't expecting this conversation this morning. And again, we are visiting with Karen Bowling, who is an amazing human, just to start with. I don't know whether to call you president or CEO.
It doesn't matter. You call me Karen.
Karen.
Oh, Captain, my captain.
Oh, Captain, my captain from, I have so many things I want to talk to you about. From WVU Medicine, Princeton Community Hospital. I need to write this down. In studio with us here this morning. If people want to find out more about these services, do they just go to their website? Yeah. I mean, how do we get people connected with these services?
So you can go to our website, and our website can take you to our telemedicine clinic. It'll let you know the phone numbers to call and how to set up an appointment.
Do they need a referral or anything
well,
like that?
If you're already in our system, then no. For example, if you're being seen at one of our other sites, we do have parents that are being seen in Morgantown, or children are being seen in Morgantown, and their provider really can just switch them to the telemedicine clinic. And they just need to ask their provider in Morgantown about that option.
Okay.
And if they have never been seen, these are subspecialists, like I said, if you have diabetes or pulmonary problems or sleep or whatever it might be, then we ask that the pediatrician do refer you so that our subspecialists will know specifically what's they looking for.
Yeah.
Okay.
Yeah. But our website.
If you're listening and you're a parent, spread the word.
Yeah.
Yes, absolutely.
Please do. Get the word out there.
You were saying about the website, I'm sorry?
Oh, yes. No, just go to our website, WVU Medicine, Princeton Community Hospital, our website, and then you just either search it or click on any links, and it'll take you where you need to go.
All right.
We're super excited about it, though. And if anybody needs more information, we also have a pretty active Facebook page. I tell people to follow our Facebook because it tells a lot about some of the activities that we're doing. And we had actually over 500, we think close to 600 people at our children's community event. And at that event, we did everything child friendly. It was so much fun. We had balloon art, and we had kids getting tie-dye t-shirts, face paints. We gave out some helmets and a car seat, and again, trying to really focus on children.
That's
good.
Great.
We like kids.
Okay. We do.
We're going to keep ours.
I'm glad to hear that.
The grown-up ones, we're like, whatever. It's like
we just love the children.
Yes.
Me too.
That's what it is. Karen, always great to see you.
Great seeing you all. Thank you. I appreciate the opportunity to talk.
But our pleasure.